Hello, Cicero. Dr. Joe Borio coming to you guys for a few minutes this morning. I wanted to just go over something with you briefly, and that is, I don't know if you are suffering yourself. Maybe you know somebody that's suffering from some dizziness. And just a real quick story, not too long ago, one of our patients came in and their father had passed away from a fall. So he was getting up in years, and he had fallen, and as a result of the injuries he sustained, he passed away. So what's interesting, and many people don't think about, is that the number one reason for senior citizens to die, it's actually so complications of a fall are the number one reason why senior citizens actually die. And when we look at this, we realize that why are seniors more prone to fall? Because they start to lose their ability to control their balance. They start to lose their ability to feel what's called proprioception. They start to lose the ability to feel where their feet are, know where their feet are. Their response time starts to drop. And it's a big concern. So what we know from that is that there's a lessening or a loss neurologically. What does that mean? Not to be too complicated, it means real quickly your brain's ability to send a message. Hey, good morning, Sam. Your brain's ability to send an electrical message from your brain down to your leg gets slowed down. So when you're walking, and you'll see that with a lot of elderly people, where they start to become what they call ataxic. They start to lose their ability, and maybe you're somebody that's suffering from that themselves. You get a lot of people with middle ear issues. You get some people that develop Meniere's disease. So you're getting issues neurologically where the brain cannot communicate, can't send those messages to the body, to the legs, to the feet, as well as quickly. And as a result, we start to lose our ability to control our movement, and in this case, our balance. So we had a young woman come in recently, and our neck is supposed to curve forward. So real quick here, when you look at this film, you're going to see that her neck actually goes in the opposite direction. Totally in the opposite direction. So she starts, we start developing care with her, delivering care to her, and what starts to happen to her spine? And we see this all the time, right? Her spine starts to improve, and what happens to her balance? What happens to her loss of balance? What happens to that dizzy feeling that she gets? All of that goes away. So her first question to me was, you know what? It's amazing, and everything you say makes so much sense. How come nobody shared this with me? I've been seeing specialists, and there's nothing against, there's so many wonderful people in the medical field out there that are really going to work and trying to do a great job for you, as well as what we try to do here. But the problem is that most medical doctors aren't looking at it through the portal of mechanically improving the function of your nervous system. They're trying to chemically improve the function of your nervous system. And I'm not saying that should never be done, but often there's drugs administered in an effort to change or diminish or in some way fluctuate the function of the nervous system, right? So if I have dizziness, or if I have labyrinthitis, which is called, or vertigo, a lot of times I'm going to get like a drug called Antivert. And what that does is it slows your body's ability, if you will, in the middle ear in an effort to function. But what it does is it affects a lot of other body parts too. So I'm not saying that should never be used, but my point is that mechanically, if this is crooked, if your spine is crooked and bent or twisted, you can answer the question for me. Is your nervous system going to work better if your spine's crooked? No. And all the Advil, all the Antivert, all the hydrocodone, all the nerve injections, they all have a place, but none of them are going to push that bone back into better alignment, right? It's just like having crooked teeth. Like, I can have really crooked teeth, and I can brush and floss every day, but it's not going to improve the alignment of my teeth, right? The only way that they're going to get better is I have to see an orthodontist, and he or she is going to put wires or braces to straighten my teeth. So the same is true with your spine. You could be in the best shape possible. You could have the best nutrition possible. You could take the best drugs out there possible, right? But the reality is, unless you see the orthodontist of your spine, in this case the chiropractor, none of that's going to change. None of that alignment is going to improve. All of that crookedness in your spine is going to be there, And unfortunately, the longer it's there, the joints wear out faster, you have more damage to the neurologic system, the body's going to get more sick and diseased, and as a result, the cure, if you will, the effort in order to get you better is going to take even longer. So listen, if you're suffering, I wouldn't even put it that way. If you have a spine and vertebrae, which everybody watching this does, you got to get a chiropractor in your life. But if you got on this video because you suffer from dizziness, or you have a parent who's suffering from some dizziness and loss of balance and such, I have to really insist, certainly encourage you, share this video, give them to call our office. If they're not local, I'm in central New York. If they're not local, not a problem. Give us a call. I would really be honored to be somebody to help your family out and find somebody that can help them out. Maybe you're in Kansas City. Maybe you're in New York. Maybe you're in California. I don't know. Maybe you're in Australia. It doesn't really matter to me. I'll make sure I can hook you up with somebody that's going to take great care of you or your family, or in this case, maybe your mom and dad. So if you're local, click the link right above. We're here in the office today. We're just going to start. My staff's going to come walking through the door here any minute. This is a quick view of the office. And it's really an honor to take care of people, so we'd love to have you come right in the office. First day you come in, we're going to certainly get to know you a little bit and get some information, take some x-rays, see where you're crooked inside that spine to get an idea of what nerves are being affected, and is your condition related to the misalignment in your spine, what's technically, scientifically called a subluxation. So give us a call. Now you can reach out to us right on our website, boriochiropractic.com, and you can actually schedule an appointment right online. You can text us or message us right online, which is great. Or you can give us a call. You can do it the old-fashioned way, right? And our phone number's right up there. And just give us a call. And Lisa or Heather or Leanne, I have some of the nicest people in the planet, or on the planet, to take good care of you, and they take great care of me as well here in the office, and to make sure that your time here with us is comfortable and happy and all about you and taking great care of you. Okay, so I look forward to meeting you. Give us a call if I can help you out in any way. Like I said, don't hesitate to message me. Also, I would certainly tell you to share this video with somebody. If you know somebody's having some problems, share the video with somebody, whether it be private messenger or on Facebook or email, but share it with them so you can try to help somebody else out. I think that'd be great as well. Listen, guys, have a great day. Live your life with passion. Have some fun today, right? And I look forward to seeing you in my office hopefully today. Thanks so much.